Imagine you are recovering at home after your plastic surgery, feeling a little tired, and then you take your temperature. It is slightly elevated, and suddenly your mind races with worry. Is this normal, or is it a serious problem? That immediate concern is completely understandable, but let us demystify what a post-surgery fever truly means. The direct answer is no. A post-surgery fever is not always a sign of trouble. In fact, a low-grade fever is quite common and can be a completely normal part of your body's healing process after any surgical procedure. Your body is working hard to repair tissues and manage inflammation, which can naturally lead to a slight rise in temperature. Your body's immune system kicks into gear after surgery, recognizing the trauma as an injury it needs to heal. This natural inflammatory response often causes a mild elevation in body temperature, sometimes referred to as an aseptic fever, meaning it is not caused by an infection. Typically, a low-grade fever is considered anything up to 100.4 degrees Fahrenheit or 38 degrees Celsius, especially within the first few days after your operation. This response is a normal part of the process, indicating that your body is actively working to recover. So, what should you do if you notice a slight fever? The most important first step is to monitor your temperature regularly and stay well hydrated. Follow all of your post-operative instructions carefully, which often include advice on activity levels and incision care. However, it is crucial to contact your surgical team if your fever is 100.5 degrees Fahrenheit or 38.1 degrees Celsius, or higher, if it persists for more than a couple of days, or if it is accompanied by other concerning symptoms. Recognizing the difference between a normal healing response and a potential complication is key. An aseptic fever, the kind that is part of normal healing, usually resolves on its own and does not come with other alarming signs. In contrast, an infectious fever is often higher, more persistent, and typically accompanied by other localized signs of infection, such as increasing redness, warmth, swelling, significant pain, or discharge at the surgical site. These additional symptoms are important indicators that your body may be fighting something more serious. Understanding the nuances of post-surgical fever empowers you to approach your recovery with confidence and less anxiety. By knowing what is generally normal, diligently monitoring your symptoms, and maintaining open communication with your surgical team, you can ensure a smoother and safer healing journey. Trust your instincts, but also trust the guidance of your healthcare professionals, reaching out whenever you have a doubt or experience concerning changes.